Hey guys, welcome back to my channel. This is Raxus and I am a Filipino nurse. I graduated in X year. I didn't want to say my age or make it obvious, but yes, I graduated in 2007 and got my license in 2008. I took the exam in December 2007 and got my license March 2008. No, April 2008. So I recently came upon this video called Differences Between RNs in Philippines and Canada. And at first glance, it does sound like it's a documentary. But it's actually an advertisement video from a college here in Canada. I think it's in British Columbia or somewhere along that area. And it doesn't come out right for me. You'll be able to see what I mean in this video. But again, before we begin, there's no copyright infringement intended. This is under fair use, wherein I'm just gonna react and talk about the stuff that's in the video. I'm talking about the video, okay? And another thing is, please do not harass any of the mentioned people in the video. Do not harass the people that are in the video. So if you have any comments, reactions, violent reactions, please write that down in my comment sections. I would prefer that you would have constructive criticism. Just relax. I will explain why I think why they got some of the parts here in the video wrong and what could they have done better, especially since this is actually an advertisement video meant to get enrollees to come into their school and study under them. So here we go. Let's just, without further ado.
What's the difference between a registered nurse in the Philippines and in Canada?
So what do you think? In the first few seconds already of the video, what do you think?
Number one, the professional communication. In the Philippines, we rarely speak to our patients, we rarely speak to our colleagues, and more so with doctors. Like they are so high up there that we do not communicate to them. But in Canada...
Now this comes out like insulting Filipino nurses a bit. Like it's telling them that Filipino nurses don't have any power in the hospital, that we don't talk with our doctors. Maybe in her experience, she may have had work in the Philippines somewhere around 30 years ago, maybe during the 80s or 90s at best. Those were different times back then. But in recent years, I think the nursing profession has evolved, and this is not applicable already to the current setting in the Philippines right now.
You really have to speak up. You really have to be very assertive on behalf of your patients. You should be confident enough to speak to a doctor, to your colleague, if your patient's safety is at stake.
So being able to converse with the doctor, it's not just about attitude, okay? So we have the knowledge, skills, and attitude that's been taught to us. So if you have the knowledge and you feel like it's something that might benefit the care of the patient, you can actually talk to your doctors in a respectful manner, in a way that you don't belittle also the years and of study and knowledge that they have to learn before becoming doctors. There's a difference in our skills, there's a difference in our knowledge, but the attitude is something that we can all share. So this is making it look like we are weak in the Philippines.
The difference that I'm going to tell you is the skills in assessment. I know we studied this, assessment skills while we were students, but
So this is one of the flaws that I see in the video. She's talking about, yeah, she knows. She studied it. She studied assessment during her nursing years, nursing college years. But when was it? Was it in the 90s? So this is not an insult on her age, but it's just pointing out that she may have had an outdated sense of outdated information on what nursing education in the Philippines is right now. I would not say that my knowledge gained in 2007 would be at par with the knowledge that student nurses have in 2015 or even this year. So that's why I train myself every year, every day, to catch up with what the students are learning now, because the students of today have more knowledge and trainings compared to when I was still a student in 2007. So I don't think it's a good thing to compare what this lady here, to compare what she learned in previous years and apply it to in a current setting. So in the hospital right now, we can actually do assessment. We have the nursing assessment. That's the purpose of our NCP. We have our ADPI, ADPIE. We have, but the thing is, we do nursing assessment. We do not do medical assessment that nurse practitioners can do here in Canada. She might be talking about the status of the patient. Now, she's making it look like we don't do assessment at all and not care about the life of the patient. We actually do that in the Philippines. That would be very, very irresponsible. Like if you have a vital sign of 200 over 120, we report that to the doctor. If you see in the ECG that there are like abnormal tracings, we report that to the doctor. If you see in the laboratory that comes from the labs and you see that there are a lot of high values, low values that are abnormal, we report that to the doctor. So in this video, she's making it look like we don't do anything at all if there are changes in the patient already. Assessment is at the top of our nurses' notes. Receive patient on bed with the vital signs. Any changes, we input it in our nurses' notes. So I don't know where she's getting this information that we don't do that at all.
Question to you, IENs. Do you get to practice that? I doubt.
Yes,
Why?
we do.
Because in the Philippines, we have interns, we have residents, we have doctors, we have students. And so you just look at the chart and they will document their...
I don't know about you guys, but this is the part where I feel like the highest point of condescension in the video. So we don't just look at the chart and get our assessment there. In fact, during my college years, we have been berated by our clinical instructors to do not do assessment with the chart. You don't do that. You're gonna fail your RLE with that one. So we do our assessment according to what we see with the patient. We have our own nursing assessment of taking the vital signs, talking to the patient, even getting some information from them. And then, yeah, the doctors are the ones that write in the physical assessment forms, medical history. But still, we have our own nursing care plan to do. It's just not documented in the chart because that's not part of the medical chart itself, but still we do it. We have our own assessment.
A complete assessment of the patient. So we do not complete it at all without practicing your skills in assessment. How comfortable are you assessing your patients and finding out what's wrong with your patient? That's
we can do
huge
nursing
difference
assessment
between in the Philippines and in Canada. Stanford College, we prepare you for that NCAS assessment because we...
Yeah, they could have done this video without disparaging or belittling Philippine nursing profession. But hey, I don't know about you guys. What do you think? Comment below.
We have a lot of practice scenarios. You can see the laboratory and my back. You get to practice back those skills again. You have to be confident enough, okay? So that before you even schedule for that NCAS, you are so confident that you can do it. Another difference, of course. Now, in the Philippines, we work anywhere. Okay, this time you work in ER, next month you work in another department. Well, it's kind of different in Canada.
So she has some outdated knowledge. Last time I checked, in 2019, you couldn't enter the hemodialysis unit without any training. So we have also started the IV trainings. We have also started trainings for operating room, but it depends on the hospital policy, wherein you would get like 1 month of shadowing your seniors and supervisors before you really start working in another area. And even when I started in in the emergency room, I had like 2 months of OJT. So, so I don't know where she's getting her information. Maybe she's referring to the general wards, wherein you can get shuffled anytime, especially when if there aren't enough staff in one area. The general wards, I think it's pretty much routine. You just have to know the different signs and symptoms that you have to watch out for per patient, or the vital signs that you have to report to your doctor. So she might be talking about specialization here in Canada, wherein if you have worked as a pedia nurse, you can stay as a pedia nurse for a long time. If you are comfortable as a medical surgical nurse, then you can stay as a medical surgical nurse. Or if you work in a cardiac ward, you are a cardio nurse. So I think in that sense, it's something that Philippines has to catch up, I think. But I think we are slowly leaning to that. Our shuffling from one area to another is a matter of necessity. It's because uh, Philippine hospitals don't hire a lot of nurses to take care of the patients. So you would have like 1:40 in a ward, one nurse is to 40. So if that nurse is absent, then you have to float another person from another unit to be able to keep up with the staffing ratio. So that's not a fault of nurses, but I'm. You didn't have to make it look like we are inept in the Philippines.
Why? Because in Canada, you need to specialize in areas. Like, for example, even before you can work in emergency, you have to go and study and complete your specialization before you can even work there. Why? Patient safety. And of course, we want that at the topmost, patient safety. And we have to be confident in
Yeah,
what we
patient
are doing.
safety is
Again, the
important.
machines are not the same here in Canada compared in the Philippines. Or maybe we have less machines there. I remember when I was a student.
And that's the point on why this video fails so much. When you were a student, and how long was that ago? Not to insult again her age, it's just that she's relying on outdated information. When I migrated in 2019, my last area was in the operating room, and we actually had, no, operating room and post anesthesia care unit, and we had a lot of machines to use for our patients.
um, we're using a ruler to measure the CVP. And then when I started working in Middle East, oh, so there's an actual CVP. So imagine those. And I even worked in UAE, wherein everything is disposable, everything is in a kit. In the Philippines, we have to gather everything. Oh, I need this one, I need this one. No, you don't even have to worry about that, because
So again, this is outdated knowledge. Kits are now being used in the Philippines. And if there aren't any kits, then your central supply room will actually make the tray for you. Yeah, let's continue.
we have everything prepared for you, but you have to be familiar and confident in what you do. So, for example, another big difference, you are about to start an IV to your patient, okay? In the Philippines, you don't even explain at all. You just tell them, okay, I need to.
Now this comes out as Filipino nurses being unprofessional. We actually do get consent from our patient. We have the main consent that we get during admission, and we have the consent that's obtained during special procedures like blood transfusion, bedside surgery, minor or major surgery. It's just that routine stuff like IV insertion, medication, already falls under the main consent, because if you try to have, like, if you have 40 patients and you have to obtain consent for every procedure that you do, plus every medication that you give, you have to give like a 5-minute explanation. You are gonna use up so much of your time in the 8-hour shift that you are doing that you will not be able to finish it. So you could have made your points in this video without having to insult, in a way, insult a whole country's profession.
Start IV. That's it. Here in Canada, you cannot do that. You will have to ask for consent. You will have to assess, as in assess. And if you believe, okay.
So I think the staffing ratio here in Canada, let me just check my file. What's the staffing ratio? So the staffing ratio in Canada is, the standard is 1 nurse for every 5 patients on average in medical surgical units, and that was in 2004. No, yeah, 2004. So imagine, God, having only 5 patients. That's like so much. That's like heaven for a Filipino nurse. So when I last worked in a government hospital, I know for a fact that in our OB ward alone, there would be about 100 patients, and there would only be like 3 nurses and then 1 nursing attendant. Here in Canada, you have this staffing ratio of 1:5 or 1:10 or 1:12, I think the maximum. 1:12, and then you have your nursing, you have your registered nurse, you have your registered practical nurse, you have your registered healthcare attendant, and you even have your PSW. So it's a personal support worker.
Even there is a doctor's order for that IV insertion, you believe that there is no benefit to your patient, you get to question the doctor. Doctor, I don't think there is a need for IV for this patient at this moment, and this is invasive. I'm giving pain to a patient. Why do I have?
So again, in a setting here in the Philippines, so I was replying to my mother. Here in the Philippines, we are, as an Asian country, we have respect for our elders. We have respect for people of higher authority. Yeah, she's trying to explain the culture here in Canada we're in. There's equality and equity. So it's making it look like nurses in the Philippines are weak or timid. I don't think that's the case. I've had colleagues that will talk back to the doctors. They were very rude, but still, like in terms of patient care, they will assert themselves, like especially for nurses that have worked in the hospital for 10, 15, 20 years. They have a bit more knowledge in the care of the patient. They will try to talk to doctors for if it's going to be beneficial to the patient.
Do that. So you have to be that kind of confident in behalf of your patient. So that's a huge difference again. Do you think you can do that? With Stanford, we will help you prepare to become a confident.
So, as you watch the video, you would keep on forgetting that this is an advertisement video. This is an advertisement video. It's not a documentary.
An assertive nurse. So again, going back to NCAS, you will be given 4 different scenarios. 2 with actual patients and 2 with mannequins. How comfortable are you dealing with actual patients and with mannequins? And it's not just plain mannequins, it's called high fidelity mannequins. For example,
again, I would not dare compare my 2007 education to the education that the current student nurses have this year, or even in 2015. Our nursing schools, universities, and colleges already have this type of training. Last I know, like in 2018, I was able to visit a state university and saw that they have this wonderful equipment for training, which includes this mannequin that she's showing right now.
they will ask you to listen to the breath sound of the patient. So you will be using your stethoscope, and then you will have to tell them, what are you hearing? They can change that. They know if you're telling lies or if you're not correct, because they know they will set what you were about to hear. So here, with our mannequins here at Stanford College, We will train you, okay? As I mentioned, the skills in your physical assessment, you are going to go back to that, okay? You will get to practice a lot with our actual patients, okay, with each other as a student, and of course with mannequins, so that you get to be prepared when you are about to take your NCAS.
So that's the end of the video. I do feel like they were trying to make an advertisement video but came out a bit of condescending, in my opinion. So I think that they could have done better without having to compare to the Philippine setting, especially when she's comparing to stuff that has happened like decades ago. So she could have just, this video could have just said that, hey, welcome Filipino nurses. We will teach you to do this. We will teach you how to assimilate. We will improve your knowledge by teaching you this, and that, without having to compare to a whole country, without having to compare the whole country profession to the profession here in Canada. She's forgetting, or maybe she doesn't know and she's outdated, that hospitals are already trying to, are JCI accredited. Universities are being accredited also to international standards. So I think that's it. If you have any comments, suggestions, violent reactions, comment below. Do not harass the people in this video. And please like and subscribe. If you hit the bell for sorry about that one. If you hit the bell icon, you will be notified of future videos that I will be making. And you want me to do other videos, just comment below. I'll take a look at it and we can react about it. So good day, everyone. Stay safe in the Philippines. God bless.